Hi everyone. My name is Aaron Mutiaba. Today we are looking at this paper. It's done in tribal dominated Mandla district. It's found in Madhya Pradesh, and that's situated in India. What we're going to talk about today, just to quickly go here and show you. This is the paper I'm talking about, and basically we are dealing with I'll show the geographical setup. It's in the forest area, hills, mountains, tribal. So the things we're going to talk about is to clearly define and the key terms. So the aim was basically undertaken to assess different roles, socioeconomic factors that contribute to malaria incidence. The key terms included tribal dominated areas, and they turned out to have more malaria cases. In the area, the geographical setup, very good breeding grounds for mosquitoes, hence having more malaria in the area. The culture housing turned out to have more malaria cases than the semi-poker houses. The agriculture, in the paper, it stated that people who had more land to practice agriculture, they turned out to have more cases of malaria transmissions. And also in the social demographic part, the more people in the family or household, they were associated with more malaria cases. The second part talks about the discussing the key terms and how they relate in the disparities. So the socioeconomic household determinants of malaria in the area were divided into three subgroups. The characteristics of the household, the housing characteristics, and the mixed dwelling. So under the head of the household, you had the age, gender, and the caste. So the age, younger people under the age of 30 turned out to have more malaria cases than the age 50, 60. And the male-headed houses were more likely to actually have more malaria cases compared to the headed female houses. And on the caste, the scheduled tribe or caste houses were more likely to have more malaria cases than other castes or houses. In the housing characteristics, the type of housing, the construction, the culture houses didn't have didn't have toilets were associated with more malaria cases than those ones which had toilets. Drinking water bodies, like people who were getting water from outside in the streams or river or pond, they turned out to have more malaria cases compared to people who were actually using tap water. This could have been probably, stagnant water bodies, or going outside, you expose your body to more malaria, mosquitoes. The agricultural land, like I said, people with more land to cultivate and grow crops and food, they associated with more malaria cases. And under the mixed dwellings, we had people who lived with animals. They actually had less malaria compared to people who didn't. Something to note is the study, they suggest that the appropriate economic and environmental interventions, even in low income and poverty tribal areas, could have huge impact on the success of the national malaria elimination goals. So the second part is to sort of evaluate the strength of the evidence. There is a good association, but as they say, correlation is not causation. So there is some association as far as the paper is concerned, but there were some elements that were not addressed in the paper. So in the paper, they talked about the seasons for mosquito transmission, but they didn't actually tell us which season contributed which percentage. Mandla district is associated with three seasons, if I may say, winter, summer, and monsoon. And most spread happens in the monsoon, but actually that information was disregarded in the study. And the other thing in the study, they say IRS at some point in some paragraphs, it turns out to be insecticide residue spray. In other paragraphs of the same paper, it's indoor residue spray. someone who is reading the paper can easily be confused. Also, the paper talked about people not knowing how to use treated mosquito nets, but it doesn't tell us which people were trained, I mean, in using those mosquito nets. It also talks about the income. I thought there were public bias and language bias. All papers were conducted in English, and there were big systematic paper reviews. There were no small publication there. There was no blinding, so I thought that was a little bit sort of a shortcoming for this paper. And also, I thought it would have been much easier to incorporate other determinants as well, like education, health, food, social services like hospitals. Those are quite very key component, especially in these tribal areas, because people were not trained. Lastly, what we're going to discuss here is how the research finding can be applied by the health professionals. So they have found out that there was an association between these factors and malaria transmission in impoverished communities. Understanding this knowledge is vital to assist healthcare professionals in determining treatments and clinical management of malaria and other infections. For example, households with the households with more than 5 members has a more chances of malaria spread according to the research paper. This could be because large families are more likely to have younger children in the families, which is a higher risk group. The number of residents in the household mosquito abundance as the olfactory cues for mosquito becomes stronger at clouding and attracts the mosquito. So healthcare workers knowing this information, they can actually be able to teach these people better birth control programs and practice of safe sex to avoid unwanted pregnancies. This skill can also be transferred, can also be transferred to other areas to assist in preventing unwanted pregnancies. And also in the research, it was demonstrated that Shelby tribal houses are prone to more malaria infections when compared with other social groups, which is attributed to lifestyle engaging. So health workers can still help these people in management program for patients, which might involve non-pharmacological interventions like referring patients and sensitization, teaching them awareness and prevention, teaching them, especially tribal areas, on how to properly use mosquito nets, maintaining hygiene, prevent unwanted pregnancies. By doing this, they are preventing malaria spread in these areas, but they are also helping them avoid waterborne and airborne diseases. And lastly, we'll have the references over there. And that's it. Thank you.